Hey everyone, welcome back to the podcast. This is Kevin Anderson, your host, and with me, as always, Adam Okada. And for this edition of the Ask the Educator podcast, we have some internal coworkers of ours. So hopefully it doesn't get too out of hand too quickly. This is going to be a fun one. We have Michael Matthews and Malinda Elammari joining us, and we are just going to get right into it. This is a really cool topic that I don't believe we've ever done before, Adam. So this is all about magnetization of your instruments. So, the very first question we got to set this up is how can an instrument become magnetized?
Yeah, I'll take this one for
Perfect.
so there's so many different ways instruments become magnetized. A lot of the magnetization happens on the surgical field within that area. And so some of the ways that that happens are the most common people always go to is those magnetic mats that we use during surgery. And what the purpose of those are, they lay them across the patient's body so that when the surgeon puts an instrument down, it doesn't go like rolling right off the patient or gets lost. So it's supposed to hold the instruments so that the scrub tech or scrub nurse can grab them and put them back or, pass them. So that's one way, it does have a bunch of magnets on there. The other way, and one of the most common ways too, is from the needle holder, the box that we put our needles in. So a lot of times we see magnetization happening in our vascular heart kind of instruments. And the reason for that is a lot of times those procedures require tiny, small needles, sometimes the size of your eyelash, and some of the strings, it's pretty cool. Like, an Ado would be like a spider's web. It's so tiny. And so what winds up happening is those needles go onto a magnet for counting to ensure that they get all those needles back and they don't get left in a patient, instead of going into the foam holder that a bigger suture needle would go into. And so every time a scrub tech or a scrub nurse takes that needle holder and touches that magnet pad with the actual needle holder and the needle to drop it, it winds up picking up magnetization. Some other ways are like pacemaker magnets. So many times, if you're doing a surgical procedure and a patient has a pacemaker in, they have to put a big giant magnet over the pacemaker while they're doing the procedure. And so, any time that there's a magnet within the procedure, and there's so many other ways out there, right? But those are some of the real most common ones that I see happening. So that's really how they become magnetized. Anything else that you guys want to add that you thought of?
No, I think you covered it really well, and it really is any magnetic field. Like if an
Yeah.
instrument is exposed to any magnetic field, it can kind of align with that field, and then it becomes magnetized. And I'm going to direct this to Michael. So, like, what is the problem with an instrument that becomes magnetized? What are the complications that can happen during surgery if it is magnetized?
Yeah, I mean, so you like Melinda said, you're dealing with sutures that are incredibly tiny in some cases. I mean, you got to think that some of these sutures, they're going to be used to actually suture together blood vessels, like these very tiny, delicate tissues. You'll see them used on, neonatal cases or heart cases or brain cases where they're using these sutures that are just incredibly small. And so consequently, when there's even just the slightest bit of a magnetic charge, it just does not take much to cause that suture to kind of misalign when it goes into the needle holder. And so and you think like, well, okay, if it misaligns, can the surgeon just like grab the suture and put it back in the right place? No, it's that tiny that if the surgeon tries touching it with their hands, it's probably just going to go straight through their glove. Right. And so the only way to effectively pick that suture up is with the needle holder, and you need to pick it up in a way that the suture is aligned in the proper way to go and do the suturing. And then when there's a magnetic charge, it'll move, it'll twitch. And then you're misaligned. You got to go back and try it again. And it just leads to a lot of frustration. Now, I have even heard that if the suture itself has picked up a little bit of a magnetic charge and it happens to be an opposite magnetic charge with the needle holder, they repel each other. And so we had this happen at a OR that I was in, where the surgeon went to pick up a suture and it just shot the suture straight off the surgical field. Just went boop, because the
Yeah.
sutures are so tiny, they weigh nothing. And so even just that slight magnetic charge can absolutely misalign, shoot them off. Like it just drives a lot of frustration.
Can
Yeah, and
I go?
to
Sorry.
oh, go ahead, Malinda. Yeah.
No, I was just going to add to that too. Also adding on to that, those points Michael made is, imagine you're deep within a cavity
Hmm.
and you have a needle on a suture, I mean, sorry, a needle on a needle holder, and you go to take a bite, and then you go on the other side and you go to pull it, and it actually magnetizes to the needle. You're so deep in the cavity, like, how do you get now you have to stop what you're doing and it adds more time, right? Because
Hmm.
you now have to fix that needle back on there and maybe it attached to the forceps or something, right? So there's so many different scenarios that can cause issues and stuff.
Yeah, it's like it happens at the most critical times when, I like to think of it as like sometimes, when you're doing a nerve repair or a vascular procedure, you're trying to suture something like a spaghetti noodle and you're using magnification like telescopes that are built into these guys' like their glasses. And so every little movement, every slight movement of this tiny eyelash like suture needle is huge under that.
Hmm.
And meanwhile, if it's a blood vessel, it could be bleeding and you're trying to stop that bleeding and all of that. So
Mhm.
it's very important to set up that why. And I think we did a good job with that. So basically, what people need to know is this magnetization is going to potentially lead to some complications during the surgery. And so, with that, I think it's a good time to transition. So, are there ways to identify magnification of these instruments before they get sent to the operating room? And I know, Malinda, we're going to kind of direct this one to you.
Yeah, so currently the way people are doing that is they are using maybe something like a paper clip. That's what I've seen in facilities where they use a paper clip and they test to see if it's magnetized. The problem with that is, we know where paper clips wind up, right? Right in your trays, they get lost all over the tables and stuff. So, um, and then other facilities, what they wind up just doing is they will take the whole tray and they'll carry it over to the demagnetizer and they will sit there and demagnetize like all their stringed instruments or like all the needle holders, all the forceps and stuff. And sometimes they miss something that might be magnetized. And so there's not really a great way to test or to do this process without creating extra work for people and unnecessarily sometimes, right? Because what if they're not magnetized?
Hmm.
And you just spent, 10 minutes over there demagnetizing stuff for no reason. So, when I thought of this product, I was really thinking like, okay, how do we create a solution that like helps reduce waste of people's time and energy, and also really ensures that the products that we're giving the patients and the instruments are safe for them and the surgeons to be used. So that's this idea, funny as it is, came from the old children's game that you had to put the hair on the bald guy and that kind of stuff and move the metal sheds around and even the etch a
Holy
sketch
Willy.
concept, right?
Yep.
So, that's kind of where this all originated from. But the goal was to really create something that's easy to use and to help the patients, be safe and get surgeries done safely and fast. And so out came the magnetic field tester, the MFT. So that was just launched by Healthmark. So,
Yeah,
yeah.
I actually have a funny story that goes with trying to find something that can, detect a magnetic field. When I first saw a magnetized instrument, it was strong enough that it was actually other instruments were sticking to it, which of
Yeah.
course, by that time, it's way too powerful. Like it's way beyond the scope of what would affect a suture at that point. So, I asked my director, I had never heard of this before. And I asked the director, like, is this a big deal? Is this something I should be looking for? And she was like, yes. And I said, okay, well, how am I supposed to find it? If if what we're really looking for are the really subtle ones. And she said, I don't know. You're now in charge of that. Like, okay, great. And so, I mean,
Congratulations.
yeah, congratulations. Right. And so I spent, hours deep diving in the dark recesses of the internet, looking for a magnetic field, measure thing, and the what it's actually called is a Gauss meter. And so you start searching for a Gauss meter, and you find out really, really quickly that apparently this is something that ghost hunters use. Like, and so like here I am on a company, computer looking at Google, and all my search results are all these ghost hunter supply sites. Like, and it's just like, this is insane. Like this is a real thing. I need this for medical purposes, and yet like I'm having to buy this from like some wackadoodle site. And we did get one. It was really cool, but it was like weirdly expensive, and I could
Yeah.
not believe that we actually got approval to spend the money that we did. And so like when I'm thinking about this product that came out of Malinda's mind, I was like, man, this is such a great solution, because most people are not going to be able to take the time to go diving through the deep dark recesses of the internet. And even if they can find one, they're not going to get the approval to spend the kind of money that a Gauss meter actually costs. So like, what is the solution? And I
Yeah.
think the new field tester is really exactly what we need.
I feel like that was just Michael's excuse to go to the dark net, but
Yeah,
whatever.
it was. Yeah,
Yeah.
absolutely. Yeah. They said, thank you for coming back. I'm like,
Yeah,
uh-oh.
exactly.
Oh my
So
goodness.
once we identify, because this magnetic field tester it's effective, it's cheap, it's easy to use. But once we identify, let's say we get our magnetic field tester and we know that we have a magnetized instrument, how do we demagnetize that instrument?
Yeah, so there isn't a device called, and Melinda's already talked about it, called a demagnetizer, right? Like, da, 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 da. Yeah, well named a contraption there, and it does reverse the polarity of the magnet and essentially take it away. And one complication, to Melinda's point earlier about trying to use a demagnetizer on the whole set, because I think some people would look at that and be like, well, let's just demagnetize everything. But the reality is that if you use a demagnetizer on a non-magnetized instrument, it can put a magnetic field on that instrument. And so it can be extremely counterproductive. So the trick is to identify which ones are the ones that have the magnetic field on them, and then use the demagnetizer specifically on that instrument. And of course, with a field tester, what you can do is, once you've identified it, just simply run it through that demagnetizer. It takes all of about 2 seconds, and then try the field tester again to make sure that it worked. And sure enough, there shouldn't be any field detected at that point.
Yeah, these two things have to go hand in hand.
Yes.
Yeah, your what did we call it? What was the product name, Melinda? Remind me. What is the one that you
MFT, the
the
magnetic field
MFT?
test.
Yeah, the
Yeah.
magnetic field tester
I
and
mean,
the
I wanted to,
demagnetizer need to go together like peanut butter and jelly. That's the way I look at it. And you're gonna need them both for your department. And I love the point that you made, Michael, about, a demagnetizer could have an unintended consequence there. And if you just use it, on all these different instruments, you could end up causing the problem. So we want to make sure that we use these two things in conjunction and use it effectively. But before we wrap up, I wanted to give you guys a chance to share any final thoughts that you might have. And Melinda, we can start with you.
well, I was just going to say, first of all, that I wanted to name it, the attractive princess tool or something like that. But, you know, I got voted out for that, whatever.
Yeah.
Um,
Crazy. Unbelievable.
She's not bitter at all. Yeah.
No, no. You just say your bitterness is justified. I would have loved that.
thanks. But I will just say, I think the magnetization is something that really does not get enough attention. And we
Mhm.
don't, it's not something that we track. We track holes in wraps, we track dirty instruments, we track this stuff, but nobody stops and is like, oh, okay, how many magnetized instruments made it to the operating room? So
Mhm.
it is an issue, it's a problem. It's just not metrics that people track and they count. So,
Mhm.
um, when I scrubbed, I remember we would get instruments. So, I scrubbed hearts. And so we would get instruments, the Castro needle holders that were magnetized, and, some of the forceps that were magnetized, and sometimes clamps, because, that magnetization can transfer to other instruments as well. And we would get these instruments, and then what we would have to do was demagnetize them during surgery. Now, think about that. How do you do that sterilely,
Right.
right? So, our thing was we had a magnetizer that had like a hole in the middle of it, a demagnetizer, and we would take a sterile light handle cover and
Oh gosh.
drop it in the middle of that hole, and while the circulator held the demagnetizer, and then take our instrument and put it into the sterile light handle cover
Wow.
to try and keep it sterile.
You guys
Now,
were creating a product where none existed.
see, there we go.
Interesting.
I mean, it was a great workaround, but however, should we have been doing that in the OR? Who has time for that? We're like
Yeah.
trying to hold a heart and demagnetize a needle holder at the same time. Like it's, fantastic. But so this issue happens, it occurs, it's a problem. And I just hope one day that we get to see, there's more light brought to the situation than what's occurring now.
Mhm.
Yeah.
Yeah, absolutely. And again, like what is our mission in sterile processing is to produce surgery ready instruments, right? And like Malinda said, the instruments that typically are the biggest deal for this, they're things like hearts, transplant cases. These are things that are coming in hot when they're coming in, and uh, an OR just simply does not have the time, nor do you want them to take the time to wrestle with stuff like this when they've got a very serious heart case going on at the same
Yeah.
time. Like that's not the right way that we should be doing things. And so again, before this the question was, okay, so what do you do? And we didn't really have a great answer. I think sometimes the OR they would mark it as broken, and it would go out to a repair company, and the repair company would sharpen it and send it right back because no one told them that it had a magnetic charge, and they're not testing for it either, right? And so
Right.
a magnetized instrument would just go right back into circulation without anything actually being done to it. And so I'm really grateful that this product is going to fill a gap that is a very serious gap, and something that I think a lot of ORs have just been dealing with for a long time. And it's like now, okay, we finally have a solution in place that can enable us to make sure that we're putting better quality instruments in the hands of those critical cases.
Mm.
Yeah, great points. Michael, Malinda, thank you so much for joining us. Listeners, thank you for tuning in, and we'll see you on the next episode, everyone.
Bye.